Same thing. I sit back on test day and I go, all right, select all that apply, breathe. Dr. Z told me what's going to happen. It's going to be one of those 4 things. Which assessment findings? What is assessment findings? They're just signs and symptoms, right? They're just findings. Signs and symptoms, that's it, right? So does the nurse expect to find? Now we're going to figure out the situation. The situation is what? It is a client admitted with serotonin syndrome because they took, or after taking citalopram and tramadol. Oh my goodness, I don't even know if they're supposed to react, or, I don't remember these drugs. Well, citalopram, you sure better know. Tramadol, I would say you can look it up if you want, but they're not asking here if this is going to cause a reaction, are they? They're throwing this in here because they're expecting you to freak out about 2 drugs maybe you've never heard of. But the point is here, they've got serotonin syndrome. So let's find signs and symptoms of something that I said makes everything hyper. Everything hyper. Sinus tachycardia, is that going to make you everything hyper? Yeah, my heart's hyper. Restlessness and agitation, mental status. Muscle rigidity, it's hyper. Cold and clammy. No, cold and clammy would be the opposite. I'm going to be diaphoretic and hot, right? Absent deep 10 reflexes or hyperreflexia? Hyperreflexia. So I just told you, again, don't freak out about these things that are going to be thrown at you. That's why I say put everything in your own words. Okay, select other apply. I'm looking for signs and symptoms because they asked for assessment findings. And what are they finding signs and symptoms of serotonin syndrome? Literally, I take this whole thing and I just put signs and symptoms of serotonin syndrome. Let me find everything that's hyper. Sinus tachycardia, restlessness, muscle rigidity. You're not hyper. You're not hyper. And now, did we learn this? Yes, we did. Yes, we did. But look at this. This is what I want you to see. Let's go back. Okay, hold on one second. We started number 1. Okay. This is the problem with this exam. And this is why what I'm teaching you, and this is why I started doing this wrap up and question portion of it. This is what I do in my group studies. I just do it for a way longer time. And then I get to know people individually as well too. But I teach this exact same thing. And we haven't missed one yet. And there wasn't one that we didn't understand. Fair? Like the concept of GI right here. 33% people got this one right. 27% of people got this right. And I bet you majority of these people probably would have chosen all those answers, but they're like, oh, all 5, I get scared. There's got to be one that I don't choose. No, you can choose one or you can choose all of them. 27%, 33%. But tell me, everybody in here should be able to answer every 3 of these questions correctly when you see it the way that I see it and you realize that I've taught you all of this, right? Now you start to feel confident. Now you're like, oh, okay, this is what he says.